Hi, welcome to Fertility Talks. I'm your host, Mary Wong. And tonight, I'm really, really pleased to have our guest, our special guest tonight, who is Jenn. And so, welcome, Jenn.
Hi, thank you for having me.
Thank you really for being here because I know that for those of you who are watching, and if this is your first time, I sometimes introduce actual personal stories. And so that's always heartfelt. And so I really honor that you want to take the time and energy to share your story because it's important. We want to know that it can happen and it'll help to provide hope. But then, we want to know that we're also not alone in this journey, right? So before we go into the meat of your story, I just want to preface it by I actually first met Jenn just via telephone because I was checking you out as a consultant. And somehow within our very first conversation, it actually came up that you were having issues. And the reason why I want to bring that up is because for those of you who are having difficulties trying to conceive and you interact with different people every single day of your life, and a lot who are strangers, but just know really that if you're at a fertility clinic, you're not alone, even though the journey is lonely. But when you're out on the street, like you don't know who you're encountering, or even in a shopping mall lineup, there's lots of people having issues and no one says anything, right?
True, absolutely.
So I really want to thank you for sharing your story. And so oftentimes I'll have patients of my own that speak about their story, but it's really awesome that you wanted to share yours. So thank you for being here.
Of course, yeah, absolutely. Well,
So
thank
let's start
you.
from the beginning. Yeah. Okay. So, the very first question that everybody always wants to know is, well, how old are you?
I am 37.
Okay. So let us know about let's go dial it back
Okay,
and start from the beginning. You're the story. I mean, we touched upon it a little bit before we started live. So why don't you go ahead and tell your story?
sure. So, I got married the day after my 34th birthday. So I was 35. My husband and I knew we wanted to start a family. And I never thought anything of it. I just thought, we're healthy, we're active, this is going to be great. We waited, we've done a lot of things that we've wanted to do in our life. And um, about 6 months after we got married, I started to get a little frustrated, thinking, okay, this something's off, like it should be happening. Um, and I started to mention it to my OB, like, look, I think something might be wrong with me. Is something wrong with me? Um, and she was like, no, just keep trying. Once you try for a year, that's when we'll start talking about other methods. But you're fine. Another 6 months went by, and I just, she's just said, okay, why don't I refer you to another doctor in my practice that does the IUI? And so,
Oh, wait, let's back up. So for those of you that do not know, IUI means intrauterine insemination, otherwise known as the turkey baster technique, but in a clinic.
yeah, exactly. I had no idea what it was either. So, okay, IUI, I didn't know much about it, but um, so we were happy to just go ahead and start and do the recommendations of what the doctors, and I really knew nothing about the IVF journey. I've heard of IVF, I heard of IUI, but I really didn't know what it entailed. I had no idea about medications that you have to take. So the beginning of it was scary when I first started my first cycle of IUI, the first time doing it. They gave me something called Clomid, which is something that stimulates your ovaries to make more follicles, I think, and get them stimulated. And it was a high dose for me. The doctor didn't even ask, if I have a sensitivity to medications or anything. I ended up going to the emergency room with like really bad bleeding, and I had a cyst, and it was from the Clomid. And so
Absolutely.
So I had to wait. I had a really bad and adverse reaction to it. So I had to wait another month before they had to go in and aspirate it. And then we waited a month, went back to do my first cycle. And they
Oh, for
put me on,
another IUI.
yeah,
Okay, so let's just be clear so that people actually get what you're saying. So you took the drugs, and what happened was they basically hyperstimulated you, and then you were left with cysts. So they aspirated it. Is that what you said?
yeah, it was pretty
Yeah.
big. They said it was the size of like almost the size of a grapefruit.
Oh, horrible, right? So you had no idea what you were getting into, and
Yeah,
like a crazy responder, and they gave it you too high of a dose. And then, of course, what happens is then you're also losing your cycle because you can't even try to conceive now,
yeah, exactly.
right?
Yeah.
Okay.
So
Okay, so continue.
yeah, it was really frustrating. Thank you. Stop me at any time if I'm going too fast. But
Just in case they don't get it, that's all. I want to be clear.
so I was frustrated, kind of scared, and just kind of like the doctor knows what they're doing. So it was a bad cycle, a bad experience. So just keep moving forward. And so the going for our second time, but for our first cycle, really, again, they put me on a different medication, and it didn't work. So we said, okay, let's go ahead and try. Well, they said they wanted to do 3 cycles, and after 3 cycles, they would probably refer me out to a different specialist. So we tried one more time, and it didn't work either. And at this time, I was just really frustrated, really thinking something was wrong with me. And so I was working with an acupuncturist local in San Diego, and I talked to this acupuncturist that I had been seeing and kind of opened up to him about my journey and what was going on. I was really embarrassed. I didn't really want to tell anybody about it because it was just personal. Plus, I didn't want to hear anybody's opinions because I'm kind of private about a lot of things. And so when he was looking at my medical records, he asked to see my medical records. He was like, you're definitely fine, but you are not a candidate at all right now for any sort of IUI insemination or of any kind, because my thyroid was really high. And I had never been diagnosed with a high thyroid before. I never understood I didn't know what that even meant. But he was the one who caught that.
Right. And I want to also actually preface this and say, listen, we're not here to, what's the word? Bash any kind of medical doctor. So what was missed was, here's the actual truth to it, because you told me what your TSH was, which is the thyroid stimulating hormone. And you said it was 3.8, correct?
Yes.
Okay. So 3.8 for like a regular normal human being is considered normal. But when you're trying to conceive, it's way too high. So that's what he caught. And I'm not sure what kind of physician you went to see when you did the IUI. Was this a OBGYN? Was this an MD? Like a general practitioner? Who was it?
OBGYN. Yeah, he was a specialist. He's a
endocrinologist
at the OBG office.
But was it a reproductive endocrinologist? Because there's a difference.
Yes.
Really? Okay, well then I'm sorry.
And he's also very well known too. In the area. So
okay,
the story gets a little interesting.
Okay, so then I guess there's a learning here. So for those that are watching, just don't assume, and maybe do some homework just to double check that they're doing things right. And unfortunately, that means you have to learn more about what's happening with your own body, right?
Oh yeah, absolutely. Yeah.
So, and it's ironic that someone as a colleague caught it. And I have also been known to catch that kind of thing myself. So getting second opinion is always important.
Mm-hmm.
Right?
Absolutely.
Anything to add about that?
Well, there were also other things that just like, that my acupuncturist, too, your colleague that you know as well, pointed out to me. When I went to my doctor, the endocrinologist, he wasn't very positive. He was very kind of ego driven, and kind of pushed a lot of my questions aside. Just kind of, he knew everything, just do what he says, even though, I kind of had a little bit of a lack of trust with him after my aspiration and my cyst experience. And I was just getting kind of a bad vibe just in general.
Yeah.
And so there were just other things like supplement wise that, I guess to each their own, but that I should have been taking at the time as well. But he was telling me, the endocrinologist was telling me that that I don't have enough follicles, that I'm, probably going to have a really tough time, and like all of these negative things. When I went to the acupuncturist I was working with, he was like, wait, he's like, you're 30. I was 36 at this time. He's like, you're 36 and you have like 14 follicles. Like, you're good. Like, he was so positive. Yeah. And so it really helped me stay mentally like thinking forward and like positive, because it was really hard to hear like negative on one side from an expert in my OB's office that I really trusted. Mm-hmm. Acupuncturist, I didn't know that much. And, all of a sudden he was the one who was really giving me a lot of good advice and positivity.
Yeah. And that's where you would get the dose of positivity, because unfortunately, when you go to a Western physician, they're only going to look at stats and figures, and they're always coming at it from a pathology lens anyway. So they do paint a grim picture. Not so inspiring, right? Oh, how did you feel walking away?
It was scary. I don't know. Your head kind of started. Should we start looking at adoption? Like, is this even worth it? Like, it was stressful. Like, what's going on? Yeah, to stay more on track. So I'm like all over the place. But when I went back to the doctor and I showed him that, I probably needed to be put on medication for my thyroid, he was really mad at me, like really mad, like started yelling and telling me that my thyroid's fine. And, it just became this total, he almost wanted to fire me as a patient because I brought it up to him. And then I said, if you don't want to work with me, that's fine. I just don't know if I feel comfortable moving forward with any more IUIs, because it's time consuming still. And, it was just frustrating. And I didn't want to take the medications if it wasn't good timing. So he's like, well, let me retest it. And he retested it and it came back at like 3.8 again. And he's like, you know what, you're right. I'm going to go ahead and put you on thyroid medication. And then he acted like it was just so weird how he was like mad at me for like addressing it.
Ego. Yeah. Unfortunately. Yeah.
Yeah. So it was a really just touch and go experience for me emotionally, I would say, because I had no idea what any of this meant. And I'm listening to the professionals around me and what they say. Mm-hmm. And, I really just decided to take a break from everything for a few months because it was starting to get stressful. And at that point, I called a IVF specialist in Irvine, and they do a free raffle once a month for people that want, that are looking to do IVF. And so I thought, okay, we'll drive to Irvine and go to this seminar where, and there was probably like, I don't know, 100 couples. I mean, there was a lot of couples in there. And so my husband and I are sitting in there for like 2 hours. And I was about ready to leave, like this, this is just really involved. Like, I'm not sure. And anyways, we stayed and they called out numbers and we won the raffle, which was pretty amazing because I've never won anything before.
And here you're winning an IVF cycle. That's insane. Yeah.
Yeah. And with, just taking time to kind of digest everything, what everything means, what it was a very minimal stimulation cycle, what have you, talking with the acupuncturist I was working with at the time and still am working with, I decided to take some more time off to make a decision like what I wanted to do, and obviously decided to move forward with it. And the very first time, very luckily for me, I wasn't expecting anything from it. We're pregnant. So it was really an amazing experience to have that, because it just seemed like it was kind of, I know there's so many hard stories to hear out there, but for me it was just really confusing, and I didn't know really what direction to go. So had I not won that IVF cycle, I'm pretty positive I would have been able to get pregnant. I just don't know how much longer it would have taken me to get pregnant.
Well, and that's the piece I always tell patients. It's, this is your journey and you get to choose, and you never want to come from a place of regret. And yes, you're right. I think you could have, and you would have been pregnant naturally, but we don't know. And no one will ever know how long it would take naturally. However, I will also say this though, you were doing acupuncture up to IVF cycle, correct?
Yes, I'm still doing it.
And you're still doing it. So meaning, like when we educate our patients, we say, you know what, if you do an IVF cycle or when you're trying to get pregnant, it's actually really good to do preconception health treatments so that you're setting your body up for a successful, healthy pregnancy to term. So you were doing that ahead of your IVF. So some people come to us when they're in a place of, oh gosh, like I'm like last minute, let's do something. So they'll do an acupuncture session just before the embryo transfer and just after the embryo transfer. And I think that's great, but it's looking at a very different piece. It's about the endometrial receptivity, meaning your uterine lining, versus actually also impacting the quality of your eggs, right? Because when we're boosting blood flow with acupuncture, and I don't know if you took herbal medicine. Did you take herbal medicine as well?
I did take some that was recommended to me, but mostly it was just acupuncture and my thyroid and diet.
Yes, absolutely.
That was, and I'm still taking my thyroid medication as we speak, and my thyroid's been 1.8 or a little bit below, and so I'm happy, and the doctors and everybody seems to be happy with that number. So,
and you know what? When you say this, I want to address this as well. So again, for those of you who are watching who may be even taking thyroid right now, just know that it doesn't have to be a permanent thing. It's just that when you get pregnant, it just puts that much more pressure on your thyroid to work harder. So then that's why when it's subpar prior to pregnancy, it's really important to get it quite low so that by the time you're pregnant, then it doesn't, make your thyroid stop working. Like it can go kaput. So here you're taking it through your pregnancy, and that's normal. And then I don't know if the doctor told you, but you may take it, up to 4 months after pregnancy, and then that's it.
Yeah, they say they pretty much exactly that, Mary. They probably a couple months or, after, and then it's not something I'm going to be taking hopefully for the rest of my life. I've never had a thyroid issue before, but you guys are the specialists. I had no idea I even had a high thyroid. I was like, what does that mean?
Oh, no, again, just to be clear, and for those that are watching, it's just on the high, like it's 3.8 is still considered normal if you're not trying to get pregnant. But if you're trying to get pregnant, it just poses that much more stress, and you have a higher incidence of miscarriage. Sometimes it impedes the ability to get pregnant too. So it's like, let's just lower it so then we don't have to worry.
Exactly. Yeah.
Right. So it's not like there's something really that wrong. It's just suboptimal.
And just to touch on that too, like I don't even notice a difference from like before I started taking my medication for my thyroid to when I'm taking it now. I just know that that it's lower, my number's lower, and that I'm pregnant and I've been able to hold a pregnancy, and so I'm I'm just doing what's recommended. And so I don't feel like I'm taking this medicine as something I feel every day or something like that in my body at all.
Right. And then the other thing to add to that, it's a low dose. We consider it more of like a micro dose, just again to keep everything leveled up so that you're having a good, healthy pregnancy to term.
Yeah.
So, any words of wisdom? What was the hardest part during this journey, if you don't mind me asking?
Well, I would say the hardest part about it is not being able to really say anything about it, because I don't really like attention, and I don't like people like feeling like babied or, oh, it's okay, And so for me, it was more not being able to really tell anybody what I was going through. And like, I think a lot of people, like once I got pregnant, people are like, oh my gosh, like you just seem so like happy and like so. I feel like I was really stressed out before. And I think a lot of it was the pressure. Is there something wrong with me? Is there something wrong with my husband? Like, part of it, we were really connected, my husband and I, so it was never really like a breaking in our relationship. But there were times where there were, okay, is it me? Is it you? And we were both kind of, I would say, just scared and kind of not like we had a problem in our relationship, but I would say we were just kind of stepping back from each other because we weren't really sure who it was, and we didn't want to blame each other. And I don't know if that makes sense, but so that was, I don't know, just hard not even being able to share even with a lot of my friends, because a lot of my friends are getting pregnant right now.
So who did know as you were going through this journey, which took 2 years? Who knew? I mean, obviously your husband.
My husband, the doctors, some of the acupuncturists that helped me along the way, and my mom, and that was it.
Okay. So that's a very private journey. And you know what? And this is what I say. And I get I need to be private and I don't want. So some people is in the frame of mind of, oh gosh, I don't want any kind of pity party, or I don't want to draw any attention, or I'm just a private person, or I don't want the judgment, or whatever it is for you. It's tough. It's tough to keep secrets. And in my book, Pathways to Pregnancy, there's a piece that I actually say, if you have some kind of a community, and if you're not comfortable with telling and sharing with the people that are in your lives, at least tell somebody, right? So it's good that you had your mom, but other places to look towards could be something like a support group or a health professional, and which you did, right? You obviously, and that is important, really. You need to tell your therapists and your acupuncturists what's happening in your life, right? Otherwise, we can't treat you as well as we can. Yeah. And you told me, I mean, I never treated you.
I told you, and you were great, because like some of the journey along the way, like, in my pregnancy, since I found out I was pregnant, it was even tough too, like, because I didn't want to, you don't want to say anything till you're at that 3-month mark, or you pass that first trimester. So I was nice to talk to you, and like, I had to give myself progesterone shots every night for like 6 weeks, and that was horrible, and it hurt. And I think I've forgotten or blocked a lot of it out now, but when I think about it, it was not a pleasant time having to do that.
No. And that's why I did a live post on it a couple of weeks ago. I showed my butt, and I, poked myself in the butt for your guys' sake. So if anybody's having to do any kind of injectables, you should totally watch that post, because I had never done shots by myself. When I was going through fertility issues, my husband did them all. So that experience was completely new for me. And I wanted to do it and be a guinea pig, because again, I was so impressed with a lot of people. So that were you one of them? Did you do your shots on your own?
I did it one time and I freaked out. I couldn't, like, my husband had to do it for me, because I'm not a needle person, and I couldn't do it.
Well, like, listen, in reality, who the heck is a needle person? Like, really?
I did it, and I was just like, ah, like I think it stuck there for a second, and I finally like grabbed it and pushed it in, and was like, okay, I'm done. Like I'm not doing it again. No.
No, no, it's a tough one, but hats off to the women that do. And sometimes, some women are in a predicament that they are alone. So some women that are virtually alone all the time because their partner is away,
Yeah.
or they're a single person just choosing to have a child on their own, right? So this happens, or like you're in a place of, I want my own control and I don't want my husband to do it, or my partner is totally needle phobic and he'll or she'll faint. So not a great candidate to do your needles, right? So the point is, some women have to do it on their own. And so that's why I created that post, because I thought, gosh, if they can do it, I'll try to do it on camera. And I did it for the first time.
Wow.
And you know what? It wasn't so bad.
It's not bad. I mean, I did it. I just like, for me, I figured my husband was there. He was willing to do it. And for me, it was just, you do it at night every time and around the same time. So it was another bonding experience that we had.
Yeah. And that's what I tell people. It's like, wow, if you guys can get through this, you can get through a lot of things in life. It's like a real test, right? Not a test that you've ever wanted, but here you are.
Well, we all have a journey for some reason, I guess. And you were really positive and helped me, like, hey, it's going to hurt, but you're going to be fine. And I just was like, I don't know if I can keep doing this. Is there any other option? Like, this is horrible. But in the grand scheme of things, I think that, my journey for me was, I don't know, I'm starting to like more empower it more, because I was so closed about it. And part of me wishes that I wasn't, but I think I had that fear of like, I didn't want to, for my friends that were pregnant at the time and family members that were pregnant, I didn't want to burden them with my sob or sad story, about like, oh, poor me, like you said, pity party. When I wanted to be try to be happy for them. But inside it was really hard, because, when you want something really bad and you're ready for it in all aspects of your life, and you're not able to accomplish it naturally, or it's not happening, it is kind of tough, because you don't, if the IVF didn't work, how many times would I have had to do it? And so for me, it was, something now that I feel like I can talk about more openly, just because I do want to be able to share that story. And I know for me, I thought it was a big deal, but I found out through me opening up about it, I have so many friends now that are asking me questions. Oh my gosh, does acupuncture hurt? Like, did it help you? How long did it take you? Does it really, so I think I help already, just from my own circle of friends, been able to open up like a conversation that my friends and I weren't openly talking about before. And I have a lot of friends that are struggling with fertility that I never even knew about.
So that's my whole point. So let's bring it back. If you had to do it all over again, would you be as private as you had been, or do you think you would have opened up more, knowing what you know now?
I would have definitely opened up more.
Yeah,
absolutely. And I'm doing it now, because I feel like it was me being so protective, like, of this, and at the time that's where I was at. But now that I know what I do, I just don't feel like there's a reason for me to have been that protective, because there's so many other cases I've heard. I have a really good friend, and it took her like 8 years, and she went through miscarriages and just like so many trials and tribulations. And she has twin boys now, and she just had her third baby all natural, after she was told she'll never be able to have a baby naturally.
Exactly. So then when you were going through this, did you know that she was having issues?
No, I had no idea.
So, exactly. So please, everyone, like, listen to this conversation and just know that you have no clue. You see someone who looks like she's like fertile Myrtle, and they might have like totally gone through like 5 rounds of IVF. You have no clue. Right?
Yeah. And I think a lot of it too was, you brought it up, like judgment. I didn't want to hear from, like, when you get married and you're older and you get married, you automatically have people, so when are you going to have babies? When are the babies going to come? And that's what we were already getting. So I think for
Yes.
me, it was more, I was even more closed off because I didn't want to, I was already getting those questions so much. And I
Yes.
didn't want to bring it up just to make that conversation more stressful, because it
Right.
was, there was already so many people in our, both sides of our family, where it was like, look, oh, we would just play it, oh, we're just, working hard and just trying to, have fun right now, and we'll get there. It just wasn't something that we wanted to add on to already all the questions that we were getting.
Right. So basically you're saying that, you felt the pressure anyway, so why the heck add to it? But
Yeah.
but sometimes opening up may in fact cause less pressure, because then you could assign someone who completely gets it and say, hey, they could be your wing person, and talk to everybody else and say, hey, don't talk to Jenn about this. Or, it's like a buddy system. So what will work for you and what won't work for you. And that's what I say can make a difference in one's experience. Because as you said, the most difficult part of your journey was keeping this silence.
It was hard. And I think that now that we are opening up to certain people in our family about it, I think there's part of our family is a little bit not as open-minded, I would say, about IVF. And there's a little bit, everybody has your own religious issues and things like that about it. So there are certain people in the family that we haven't really just told, because we don't want to hear their beliefs on certain things. So,
Sure, absolutely.
but
And that's great.
that we have opened up to about it already in just a short time, I've had 2 family members come up to me and ask me if they can talk to me, because they've been trying and it's not
Mm.
working for them.
Okay, so that's really great.
Yeah, and so I just think that, I mean, I still think you kind of want to be selective. I feel like for me with my own family, I'm more selective with who I tell than just like my friends and people that I know, because you just know there's certain people in your own family that just don't think the same way no matter
Right.
what you tell
I
them.
get it. Yes. I totally get it. And what you're alluding to there is like, yes, you do need to discriminate as to who would be a good fit. But although sometimes people will surprise you, for someone you may think would be quite close, or actually the opposite, and vice versa, right? And
Yeah.
and then you kind of really see who are your true friends too. or you know what, that's not even accurate, because sometimes you can have a good friend, but they just don't get it. They don't get it because they have never experienced it.
Yeah.
Although I have to say, my best friend, who I did tell, she never had any fertility issues. In fact, she got pregnant at the age of 30 by accident with a guy. Oh, I don't know, I'm saying too much, but she ended up staying with him because she had a kid. So although it was so easy for her, she was very empathetic, surprisingly so. So, like, sometimes you just actually don't know who are your real champions.
Yeah, I mean, I agree with that. I have some really close girlfriends that, like you, same situation. Well, they are easy to get pregnant, that know, and they are my biggest cheerleaders. Like, oh my gosh, I'm so excited for you. Like, when are you doing this? Or, helping me like with a lot of questions I have now, like, and they're just so excited. And so, yeah, you don't know how people are going to react. And I do feel really blessed in the fact that, what I do professionally, that I do have support to help with a lot of these questions that I do have, like with you, Mary. Like, if I need something, you're really good about helping me answer that and seeing a big picture, rather than, if I'm scared about something. No, don't be scared about that. Like, just open your world up. You're fine. You're going to think positive. I think it's really easy, at least for me, to think of like the worst case scenario, or to get like kind of down on myself or hard on myself. And so it is nice to have really positive peers around that are there to help keep you at a good mindset.
And so the moral of that story is, and if you don't have that kind of support, then and find some, right? Like create
Yeah.
a community, find a community, just to lighten up this difficult journey. And so I don't want to belabor this topic because we could just talk all night.
Oh, yeah.
And so let's just wrap it up. So if there's any one advice that you would want to share with those that are struggling right now, what would that be?
I would just say, don't be scared. Don't live in fear like I did for a good year. And try to stay positive and be open to all the suggestions, and just do what's right for yourself. And if you can, talk about it. That's one thing I wish I would have done, is talked about it more. I think that would have helped probably with my stress levels too. So I would say that's the biggest one, is don't be afraid and talk about it, because there's other people out there that you don't know that are going through the same thing, or that have already gone through it.
Well, you know what? I'm so impressed that you're speaking about it now, because there's a lot of women that still won't, even while they're pregnant. And, I think it's really, really great what you're doing, because I know your story will make a difference and just allows women to have a voice of their own as they struggle through this, right?
Yeah.
You're giving them an opportunity. So thank you for that.
Of course. Well, thank you. And we'll keep you posted.
Yeah. Well, you're 30, what weeks?
I'm 32.
32 weeks. Okay. And for those that you don't know, but you're carrying twins.
Yes.
So
always.
Yeah. Awesome. So you got the 2-for-1 deal.
Yes.
But we got to be careful, because we want to, the good thing is you're at 32 weeks. So the babies are like what I call ripe and ready to go. So they're good. But ideally, you just want to keep them in as long as possible. So for those of you that are like wanting, let's just go straight for twins. I say I don't actually recommend it. But if you're there, you can actually have healthy twins.
One thing on that, Mary.
Yeah.
It's an amazing journey with the twins, but my gosh, one is probably plenty. Like it's people say, oh, twins. I've met some twin moms, and they're like, it's gonna get rough, and I'm like, no, this has been easy. No, it's fine. No, it's getting real.
Yes, it's getting real. So you really need support around that, especially for twins. I know in Canada, at least in Ontario, where we're from, there's a service, and it's a free service through the government that will, you could call on a nurse that comes into your home every week. So I don't know if you have any kind of like free services for that postpartum. If there is something like that as a service, you should totally sign up for it.
That's a good suggestion. I'll look into it.
So check into it. Yeah. So again, thank you so much. I don't want to spend here all night. And
thank you.
And I want to thank everyone for watching. And please share this, because with your friends, and even if you don't have issues, share it so that you can reach out to those that do. And scroll down below. I have 127 posts, I think now, something like that. So lots of good, juicy things. And what I always say is, like, some information's okay, but unfortunately, a lot of stuff on the internet, you go down this bad rabbit hole, and which can cause more stress and overwhelm. And what I try to do is talk about topics that are real and that will be helpful and hopeful and inspiring, hopefully. So thank you for joining. And we'll have another Facebook Fertility Live talk soon. And you can check out marywong.life, where I have all my posts on there as well. And also my book, Pathways to Pregnancy, on there. You can subscribe, and you can get one of the chapters for free. I think it's the first chapter. I don't even know what chapter, but anyway, it's all good. So thank you for being here. Love you guys. And thank you again, Jenn. And I wish you all the best. And it's so cool to actually see you face to face.
Yeah,
Because I normally talk to you on the phone. That's it.
I know.
Okay. All right. Thanks, guys. Have a great night.
So,
All right.